So you just been prescribed psych meds. Now that's kind of scary, psych meds. You went to the pharmacy and they print out the medical jargon, just like reading a different language. Because the medical terminology with the pharmacy print out, totally confusing. Then you might talk to a nurse like myself and we probably just spoke the side effects so fast, probably went right over your head. Because to us, it's so common, it's just like muscle memory. So we speak so quickly and matter of fact that you probably didn't understand one single word. In this video, we're going to go over the common side effects. And we're going to go over side effects when you should call the doctor. I'm Stevenson Davis. I'm a psych nurse for 17 years. And I'm giving you the psych nurse tips about psych medication. First of all, take a deep breath. Just medication. Millions of people take medications. And because you have the word psych in front of it, that could be quite scary. Think about it. Psych meds means psychotic medication. Ooh. Oh, you nuts? Are you crazy? You go to Google, it's going to tell you all kind of weird stuff. And AI going to tell you what's on Google. Man, this could be very confusing. But let's do step by step. I'm going to do three things today. Common side effects, caution side effects when you have to call the clinic, and emergency side effects when you have to go to the doctor, ER, or something like an urgent care. Number one common side effect to most psych medication. For example, you're taking antidepressants, anti-anxiety medication, you have a panic attack, you have mood disorders, even schizophrenia. First thing you need to know is your body is made of chemicals, and your body know that a foreign substance inside its body, meaning like you putting medication in, it's going down, your body is reacting. And the weird thing is, you're going to have the side effects first before you get the good benefits of the medication, which sucks, but it's just the way it is. Your body got to get used to the medication. Your body going to conform to the medication. Your brain going to alter so the medication will start working. So the most common side effects is upset stomach. Because again, you think your brain got all the receptors, serotonin, dopamine, but there's those receptors inside your stomach. Upset stomach, nausea. If you've ever been nauseous, that's really, really feel bad. Nausea, make you headaches, about drowsiness, involuntary movement, about dry mouth. So you are getting affected with these common side effects. And when you tell somebody, like a nurse, or you call in the hospital about the common side effects, they're going to tell you, well, it's common side effect. Just keep taking it. Don't worry about it. Don't worry about a thing, sugar. Talk to you later. That's like a 15 seconds phone call. But it's not coming to you. It's your body. So to you, it's not coming to be feeling like that. Nausea, headache, drowsy all the time, involuntary movement, confusion, brain fog, feeling medicated. I don't want to use medical terms. That's not coming to you. So what I want you to do is not only write it down, but I want you to ask the doctor or healthcare professional, what can you do about these common side effects? If it's making your stomach upset, can you take it with food? It might be written to take on the empty stomach because it's the best to take the medication on the empty stomach to absorb the medication in the bloodstream, but it might not be for you. Right? So you call the doctor and say, hey, this is messing up my stomach. The doctor might say, take it with crackers, peanut butter, nice snack, bread or toast. Now, that side effect is taken care of, but you have to let the healthcare professional know first, right? What about nausea? You get nausea. You ain't pregnant? Ask the doctor, can you take this medication with nausea medication, like Zofran or whatever they describe? Is it available to take with it? What about it? Can you take Tylenol with this medication to get rid of headaches? Right? What about if it causes you drowsiness and you have to go to work, you got to take care of kids? Can you take the medication at night? These are the questions you need to ask the doctor. In most cases, the doctor is going to agree with you. Okay, if you can't take it in the morning time, take it at night. because we want you to take your medication. If your medication make you have upset stomach, eat it with food. It's okay, because we want you to take your medication. If the medication making you feel sick or medicated with nausea, take nausea medication with it. So, but first you gotta tell the healthcare professional the common side effects, and don't let them blow you off with the common side effect stuff. Oh, this common, just keep taking it. No, you don't need to feel like crap while you're starting medication, because the medication not gonna kick in to about 3 to 4 weeks, sometimes even 6 weeks. You want to suffer those weeks, a whole month until the medication kick in? No, talk to your healthcare professional. You got to do something by these common side effects. And let me tell you a little story right quick, psych story. I had a patient, teenager, who was not taking his stimulant, ADHD medication. Why? Because the medication messed with his stomach, because he couldn't eat all day long. So I talked to the doctor. The doctor gave the medication with crackers. That was it. I had another patient, she had severe dry mouth. But in the hospital she was in, the behavior hospital, they had a protocol, there's no drinks in the room at night. Once I found out, I got her doctor orders, give her some water by her bedtime so she can sit up all night when she wake up and go to the restroom. The doctor doesn't prescribe sugar-free lozenges. But as a psych nurse, I want you to ask the doctor, can I take some hard candy or sugar-free lozenges for my throat if you don't have no swallowing problem? So there are remedies. In side note, since the medication takes so long to kick in, you may ask your doctor for medication. Now, this is for educational purposes only. I'm not your doctor. However, you might need to ask the doctor, hey, if there's another anti-anxiety medication I could take until this medication kicks in 3 or 4 weeks later, or depression medication kicks in. For example, hydroxyzine, something that's non-habit forming, because you don't want to get addicted to another medication while you're just starting another medication. That defeats the purpose. However, I don't want you to just sit there and suffering do this long period while you already suffering anyway. That's why you went to the doctor. You had a problem. So you needed medication for the problem. So you don't want to wait until a whole month for the medication to kick in. Sorry. Sorry, phone ring, but it's almost dropping there. Somebody trying to give me a job. Okay, try again. Now those are the few common medications. We're going to use it as like a stop sign. Those are the green lights, common side effects. You don't stop taking your medication. You call the hospital to try to figure out remedies for those common side effects, so you won't be suffering during those 3 weeks before the medication kicks in. Now, we got a yellow light. The yellow light that's when you call the clinic. When you have these side effects and they last more than 3 to 4 weeks. You're not getting better. Your body not adjusting to it. Your brain not getting adjusted to the medication. You're just studying suffering. You're taking the medication for nothing, basically. It's 4 to 5 weeks and nothing is happening. You're just taking the medication to make you feel sick. Unlike yourself, you're getting involuntary movements. It's not working out for you. Now, what I did in this video, I made a PDF where you can download for free. It's a checkoff list. I'm a checkoff list kind of guy. So my checkoff list, you have to check out behavior, your mood, your nausea symptoms, pain. You got a checkoff list, right? You got what is common, when you should call the hospital, and when it's emergency. It's all written out for you. Short, simple terms. You can read it. You check out the checkoff list. The reason why you have to monitor yourself on medication, because when you call a doctor or your healthcare professional, you need to know the information to tell them so they can do the right protocol. For example, as a nurse, when I call a doctor for you, I have your whole history. That's why it takes so long for you to be in the clinic. I call the doctor. Yes, doctor. The patient been taking the medication. Start here. Side effects here. This side effect went away. She got new side effects. And also, she think the medication is making her worse. What happened is, the doctor might stop that medication and prescribe another medication, because your body is a stranger to the medication, and the medication is a stranger to your body. Your body is different from every other body on earth. So that's why you got to document it. So when you describe your symptoms, they know it's not common because of the time. They know you got a new side effect because you got it documented or just checked off on my PDF checkoff list, which is for free. Download it. It's good checkoff list. Right? So you be like me when I call a doctor. The yellow light is when it's not working. It's been 4 weeks now. You still have these same side effects. You still out of the mood. Nothing got better or worse. It's going on 5 weeks. You call a doctor and notify them, hey, this medicine is not working for me. I feel like crap. I feel like quitting. I'm tired of feeling sick every day. I'm tired of being nauseous every day. I can't never sleep. I got these involuntary movements. I got this brain fog. You know what? I'm just wasting my time here. So the doctor needs to know that. That way we can adjust your medication. We give you more or we give you less. Because you may have serotonin or dopamine problem. It might be the right adjustments. It might be a whole different medication that they may prescribe you. You need to know what to do next, right? So the yellow light is very simple. It's not working. This is what it is. You got documents. You can tell the doctor exactly what happened. Now, the red light doesn't mean stop in this situation. This red light means it is an emergency. You have to go to urgent care, emergency room, or you have to call 911. If this is severe, for example, severe headaches, severe cramping, severe involuntary moving, you're swelling up. If you're swelling up, face can swelling up, you got difficult breathing, you feel like you're finna die, feeling a doom, you get more suicidal, more depressed, you're more anxious. You're having a severe reaction to the medication. It doesn't mean that. It means that this medication is affecting your body seriously. And the worst thing you can do is stop taking the medication. You never want to stop taking the psych medication abruptly because your body hasn't adjusted to it and your body start making certain chemicals that your body need or the medication is taking over. That's why you want to do this in the clinic, in the emergency room, where you got tools to help you. We got doctors, that's the tool, nurses, we got equipment, we got the right kind of medication to monitor you. That's why you can never stop taking a psych medication abruptly. Unless the doctor tell you to. If the doctor or physician tell you to, then do it. You don't say, hey, Google said don't never stop. The doctor told you to stop. That's the only reason you stop. But other than that, you don't never stop taking the medication abruptly. Even when you change the medication, they may have to taper it down while you add in another medication at the same time, so the other medication kicks in when you're tapering off the medication that's not working. Again, this is for educational purposes only. I'm not your doctor. I'm not a doctor. I'm here to teach people about side effects of medication. When you call me when I'm at work on the job site, I don't have much time. I'm very busy. My patients are priority over you. Even though you're a family member on the phone, even though you got a lot of anxiety, you're going through hell, but my highest priority is my patient that I'm watching, I'm monitoring. So I'm going to keep it limited to you on the phone because I got to make sure my patients are safe, my staff is safe. It got a priority system. So again, take my free PDF download it for free. It's going to be in the description of this YouTube video. And monitor your system. And this was this video about the whole week. And I'm going to tell you a side note. If you're having stressors and you think it's anxiety or depression and it's a stressor, you just remove the stressor and everything else get better. So watch my videos of stress or anxiety. Because basically it's just simple. Stress is external, anxiety and depression is internal. Stress, you can remove the stressors even if it may break your heart. It might be a family member, it might be a parent, it might be a brother, it might be a loved one. It could be a job. It could be you waking up late every day, rushing, trying to get to work. It could be a host of things, right? But let me summarize this again. Number one, it's nothing wrong with you. Millions of people take medication. You just have to take medication. It's okay. The most famous people on earth took medication, right? Number two, common side effects. Don't have a panic attacks over the common side effects. Let somebody know, make sure you verify they are common, and try to ask the doctor or healthcare professional some remedies you can take that are safe to take. Nausea pill, eat the food with food. Eat the food with food. Eat a snack with the medication. Or it's anxiety medication. There's a lot of anxiety medication till it kicks in. There's a lot of remedies you can do. Now, the yellow light, when things are not getting better, you're taking the medication, but you still have all these side effects for 3 to 4 weeks now, 5 weeks, and nothing is happening. You got to talk to the doctor. You got to talk to the doctor because something got to be happening. He really don't want you taking medication just to take the medication. The medication is going to fit your problem. Lastly, red light doesn't mean stop. It means get help now. Go to the emergency room, urgent care, or equivalent. Call 911 because you need to get off this medication, but you can't stop that properly. You need to be in a hospital who have tools like doctors, nurses, medications, people to watch you and monitor you while they get you off this medication because you might be just allergic to the medication. I think that's about it. I will see you in the next video. The main thing I want you to do in this, drop a comment of some uncommon side effects that you ever heard about medication. And also, drop me a note. You might want to ask me questions. Right now, I can answer your questions. It might take me a couple of days, but I can answer your questions for educational purposes only. But I'm a psych nurse. You have a free, direct link to me. And I'm going to leave you with my weirdest common side effect. I was taking prednisone, and it gave me a side effect of hiccups. For 3 weeks, I was on prednisone and had severe hiccups. I couldn't stop it. I went to work with hiccups. I did my self-assessment hiccups. Apologized to the patient. I'm sorry I got the hiccups, but I got to get through this. We got to get through this. That is a weird side effect. I had another patient who took Celexa, who had a rash. It was not a common side effect. She didn't have the other severe. She had a rash. It was a weird rash. She had to stop taking Celexa. Her body didn't work for it, right? So you want to make sure that you document your medication when you talk to the doctor. Listen, if you're not good at documenting stuff or checking stuff off, ask a loved one to do it. Ask somebody else to do it. You got to help. You got to use your resources in the world. That's about it. To the next video, okay? Deuces.